Hey, it's Dr. DeCubellis here, and I get asked a lot, why do I have pain when I wake up in the morning? There are a couple main reasons why you could be having that pain, especially when you wake up in the morning. It's more concentrated or it gets better as the day goes on, but waking up is super painful. And I want to go over a couple reasons why that might be happening. The first is going to be the disc themselves. Now, what happens with the disc is that as you're standing up, as you're moving, as you're sitting, your disc gets compressed. Your whole body weight is pushing down, whether that disc be in your neck, your mid-back, or your low back. You have weight that is pressing down from gravity. When you are relaxed and you're sleeping and you're laying down, that pressure goes away. So the disc can actually start healing. It can start getting more nutrients, more fluid into it. So your disc actually becomes thicker or larger in the middle of the night. Now, when you go and wake up, that pressure is compacted back down the disc. So you start to feel that pain again because the disc is under those pressures from gravity and your normal body weight. So sometimes those pains in the morning can be from your disc. Now, next, it could be coming from the muscles themselves. Now, a lot of people talk about muscle pain, aches, and things like that, but sometimes the muscle pain that you're feeling is not the actual problem. The pain you're feeling from the muscles is because they're compensating for something going on underneath. As you're moving and you're walking and you're standing, your muscles are clamping down and they're compensating for an underlying issue. But when you lay down to sleep, those muscles relax. They're no longer compensating. They're resting from all of that overwork they've been doing throughout the day. So now is their chance to start relaxing. But then when you first wake up and start moving, they're not compensating. So you feel all the issues that were underlying the whole time. This is why it gets better as the day goes on. The problem's still there. Your muscles are just compensating. So that pain in the morning is not the muscles themselves. It's that the muscles were compensating for the underlying issue, and they don't do that until you start moving. Now, another reason is going to be sleep position. People sleep in many different positions, whether that's on your back, your side, or your stomach. But not all of these are going to be great for you. And it all depends on A, if you have any underlying issues, B, your pillow, and C, your mattress. So there's no one great position for everyone because we have those underlying factors. But I will tell you that overall sleeping on your stomach is the absolute worst thing you can do. It puts abnormal pressure on your lower back, which compresses those discs and those facet joints, and it's going to cause muscle tension. So sleeping on your stomach is the absolute worst. Your back and your side are both very good, but which one's better depends on if you have any underlying issues and your pillow and your mattress. So waking up in the morning could be from your sleep position. Waking up with some minor issues here and there every so often, that's going to be okay. That's normal. But if you're consistently waking up with pain in your back, your neck, or you're getting sciatic pain, and this is a consistent thing that's happening every morning, that's when it's time to get it checked out. It's always better to be safer rather than waiting long periods, letting issues get worse, and then it takes even longer to get it better, or you can't get it better at all.